Hi everyone, my name is Zade Gray and my presentation today will be on a plant-based diet and its metabolic benefits of consuming plant protein. So to introduce this topic, basically suboptimal nutrition is a major cause of obesity, chronic disease, and premature death across the nation and worldwide. Certain dietary habits such as high intakes of sodium, processed meats, and low intakes of fruits and vegetables are associated with 45.5% of cardiometabolic deaths in the United States. Fortunately, though, research has shown that a plant-based vegan diet is beneficial in improving nutrient intake, decreasing all causes of mortality. It decreases the risk of obesity, type 2 diabetes, and coronary heart disease. So one may ask, what is a plant-based diet? A plant-based vegan diet excludes all animal products and is centered around grains, legumes, vegetables, and fruits. So, another question that may be asked is, can a plant-based diet reach protein requirements that are needed for the human body? So, yes. Sufficient protein intake is necessary to supply nitrogen and amino acids to our cells to ensure the growth and maintenance of the protein pool in our bodies. However, a diet based entirely on plants provides all essential amino acids and an adequate quantity of overall protein, even without the use of special food combinations. So the consumption of exclusively plant protein has been associated with reduction of the concentration of blood lipids, obesity, and cardiovascular disease, which is good news. All right, so to further introduce this topic, you want to know what the objective of the study is. So in this secondary analysis of data from a 16-week randomized clinical trial, it explored the effects of plant protein as a part of a plant-based diet on weight control, body composition, and insulin resistance in overweight individuals. So the three keywords here are, what is weight control? And that's the managing and maintaining of a healthy body weight. What is body composition? This is used to describe the percentage of fat, bone, water, and muscle in human bodies. And then what is insulin resistance? So this is a condition where the body does not respond to the hormone called insulin, and it's unable to convert the glucose into energy, something also known as diabetes. So the methods, I'm just going to basically explain the study design of how this study was done. So the study was conducted between October 2016 and June 2017. Using a single center randomized open parallel design. Healthy overweight or obese adult men and women with a body mass index between 28 and 40 meters squared were enrolled. The exclusions were history of diabetes, smoking, alcohol, or drug abuse, including pregnancy or lactation, and current use of a vegan diet. So anyone that had these criteria were not allowed in this study. Participants were randomly assigned in a 1-to-1 ratio to a vegan or a control group based on a computer-generated randomization protocol, and the randomization protocol was not accessible beforehand, so no one would have had any idea of who was going in which group. They were all examined at baseline and then at 16 weeks. So the vegan group was asked to follow a low-fat vegan diet consisting of vegetables, grains, legumes, and fruits, and they were instructed to avoid animal products and added oils. Any daily fat intake was 20 to 30 grams, and no meals were provided. So basically, they were on their own with trying to follow the guidelines of what they cannot consume. So participants in the control group, on the other hand, were asked to maintain their current diets, which included animal products for the duration of the study. So here we have two groups. The control group, who's allowed to continue their regular diet, which included animal products. And then we have the vegan group, which of course only consists of vegetables, grains, legumes, and fruits, or anything of that sort. And vegan protein as well was also allowed. So maybe like tofu, Beyond Meat, something like that would be also allowed in this as well. All right, so here we have the characteristics of the study population. So the age was 53.2. That was like basically the average age, and it ranged with 53.2 minus 12.6 and up to 53.2 plus 12.6. So for example, the highest age would have been probably about 55.8 years old. There was more females than males, 89% females, 11% males. Also, ethnicity, there was 45% whites, 45% black, Asian Pacific Islander, 5%, American Indian, 3%, and those who did not disclose was 1%. So this is just basically showing the facts of, the characteristics of those who were in this study. All right, so continuing on the methods. So we have here the dietary intake and physical activity. So a 3-day dietary record was completed by each participant at a baseline and 16 weeks. So it was collected and analyzed by a registered dietitian. The study participants were instructed not to change their physical activity and to continue their chronic medications, except as modified by their personal physicians. All right, so, it was a recorded 3-day dietary record completed at the beginning and at the end of the 16 weeks. So all measurements were performed at baseline and 16 weeks on an outpatient basis after 10 to 12-hour overnight water-only fast. So we have here how the height was measured using a standometer, weight was measured using a periodically calibrated scale, body composition was measured using a DXA scan, and amino acid intakes were assessed and used as predictors of changes in body composition and insulin resistance. On to our results. So the overall physical activity remained consistent among both groups. Energy intake decreased across the study with no significant difference between the groups. There was a significant reduction in body mass index and body weight were only observed in the vegan group. A decreased intake of animal protein was associated with a decrease in fat mass, and only the vegan group had significantly reduced HOMA-IR, which stands for the homeostatic model assessment for insulin resistance, and that's how it's usually measured. And here we have like a graph of the results. So if you are to see here, the one that's fully shaded is the final, and the one that has like the stripes is the beginning. So for example, in fat mass, for the vegan group, you can see that the shaded one, which is the beginning, was higher, and then by the end of the 16 weeks, their fat mass dropped. And in the control group, it pretty much remained the same, and the control group is those who maintain their diet. So it's more obvious that it would probably maintain the same for fat mass. On this slide, I'm basically providing definitions of essential and non-essential amino acids that are often mentioned in this study. One thing that can be noted is that non-essential amino acids in plant protein promote higher net glucogen activity than an omnivorous diet, promoting weight loss and reduction of LDL cholesterol. In the discussion, what was discussed was that a decreased intake of animal protein and an increased intake of plant protein were associated with a decrease in fat mass by 1.45 and 0.88 kg respectively. Increases in body weight were positively correlated with an increased intake of animal protein, especially in women. And decreased leucine intake was associated with a decrease in fat mass by 0.82 kilograms, independent of changes in the BMI and energy intake. All right, so to conclude, the quantity and quality of dietary protein as part of a plant-based diet are associated with improvements in body weight, body composition, and insulin resistance in overweight individuals. A greater consumption of plant protein in replacement of animal protein resulted in decreased fat mass. Decreased leucine intake was associated with a decrease in fat mass independent of changes in the BMI. Additionally, decreased intakes of histidine, threonine, leucine, lysine, methionine, and tyrosine were each associated with a decrease in insulin resistance. I thank you guys so much for listening to my presentation.